I'm going to try and highlight to you the main outcome from the regional committee. That is the most important meeting that takes place once a year for WHO, the World Health Organization, here in the region. The regional director, Dr. Fikri, gave his annual report. He talked about the achievements and progress in the year 2016. He touched on a lot of subjects. Foremost amongst them was universal health coverage, how the World Health Organization hopes that every person in the region will have access to health services and quality health services at that, how that is to be achieved in a region where you have disparity from very rich countries to very poor countries. Also discussed was the maternal, child and adolescent health, the importance of that, how we need to decrease maternal mortality in the region, how adolescents, we have to raise their awareness. Lots of topics were discussed on that and many achievements in the countries in the region. Traffic injury came out very high, considered one of the non-communicable diseases that lead to death. So now all ministries of health in the region are prioritizing traffic injuries as well. Environmental threats, whether they be drought, whether they be coming from natural disasters or man-made disasters, we're all getting a lot of threats. Emergencies, when I mention disasters, come at the very top of the annual report. Our region is filled with areas of conflict. We have Somalia, Iraq, Yemen, Syria. The difficulty of getting even something as simple as vaccines to each and every child in the camps, in difficult areas, in some places where there is drought, there are international people from all over working there as partners. That was also mentioned. Non-communicable diseases, many of you may ask, what do they mean by non-communicable diseases? They are the diseases that are affecting our region now. Speaking with the Minister of Health from Oman, has overcome a lot of the communicable diseases. Yet, we have cancer, we have respiratory illnesses, we have diabetes, we have mental health and disorders. All these are increasing in the area, possibly because we are screening faster, we're finding out more about these diseases, but they are definitely spreading all over. And there is a need. And there were reports about a lot of things that have been conducted. Amongst them is a kit that the World Health Organization has just devised, which deals with giving medical supplies, especially in emergency areas. Polio eradication, we're nearly there. He talked about the importance of every child being given the polio vaccine. Only Pakistan and Afghanistan remain in our region, as well as Nigeria. If these three countries succeed in eradicating polio, we will have been there. There will be another smallpox success worldwide. We will have eradicated another disease from the world. So I would urge you all, please make sure, especially in these two countries in our region, Afghanistan and Pakistan, immunize your children, make sure they get the vaccine. He talked also of vaccine-preventable diseases. And these, everybody varies in the percentage of the children who are vaccinated. But he emphasized specifically measles. It is possible to eliminate measles. We need to gear up the efforts worldwide to make sure that everybody gets the measles vaccine. Another main topic that was discussed that is giving a lot of grief to WHO worldwide is antimicrobial resistance. And here we have to warn all the public, please be careful. Please be careful with your use of antibiotics. Antibiotics should not be used indiscriminately. You need a prescription from the doctor, or else soon they will have no effect. We need to raise the awareness. Don't get it from a pharmacist. Don't use it yourself. Don't give the same antibiotic to your two children. Make sure the dose is given in full so we don't get resistance. Later, he introduced his roadmap. Dr. Fikri talked about a roadmap that was built on 4 pillars, and he highlighted the 5 areas where he will be working on in the coming years. The first amongst them comes naturally, emergencies and health security. The region is afflicted with them all over. The second is communicable diseases, where he hopes to eradicate some of the very rare diseases, as well as trachoma being added. He mentioned filariasis, schistosomiasis, many things that we need to get rid of as well. Non-communicable diseases, which I have highlighted before, maternal, neonatal, child and adolescent health. And finally, ended with the importance of health systems. The importance of health systems, which are the basis, the pillars for every Ministry of Health in the region. One more thing on the sidelines of this meeting was the importance of public-private partnership in delivering health. In the region, because the Ministries of Health don't have sufficient funds, we are seeing more and more of the poor people having to pay out of pocket and go to the private sector. This cannot continue. We need the partnership between the two. Thank you.